Hi, everybody. Thank you very much for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services activities around the website at medcommsnetworking.com and the associated websites. So information services and so on for people who work in and around the global MedComms community, by which I mean people who work in and around medical communications, medical education, medical publishing, and indeed very interested in reaching out to people who would like to learn more about the business, maybe get a job in MedComms and so on. Those people will find lots of information at first medcommsjob.com specifically. I'll also put a plug in for NetworkPharma TV. You'll find there's more than 400 videos now. Many of them are recordings of webinars like this, but there's other sorts of video content as well. So there's lots of good resource there if you're working in or around MedComms or wanting to learn more. Today, I'm absolutely delighted we're joined by Helen Kane, who is going to talk to us about the role of MSLs and broadly medical affairs and how MedComms can do more to support that area of the business. So without further ado, Helen, over to you.
Thanks, Peter. Hello, everyone, and thank you so much for the opportunity to be with you today to talk on this subject, which I really hope I'm going to do justice in over the next 45 minutes. I am certainly going to give you a perspective on the role of MedComms in supporting MSLs and their activities. There's a huge amount to consider when we think about the MSL role. But in order to sort of create some context for all of you on the line, I'd like to introduce One MSL. So One MSL is our brand name, and a little bit about us. So I'm CEO of One MSL. And as you can see on this slide, we are let's call it a boutique agency, a specialist medical affairs training and consultancy agency. We were established in 2015 after a 25-year career within medical affairs. And today, I'm really proud to share that we work across the global biopharmaceutical industry. And I guess what separates us perhaps from other agencies really is the expertise that sits within our team. So you can see we have over 100 years combined medical affairs expertise. And we work with clients throughout the drug life cycle, and really we tailor our offering according to needs. So we are not a kind of cookie cutter approach agency. And it's everything that we do is really thinking about maximizing the impact of the MSL and, of course, the MSL leader towards the achievement of medical and product strategic objectives. So, you know, our mission, we are motivated by a passion to work with individuals and to work with teams within organizations to drive best-in-class behaviors through capability upskilling. And, you know, for all of you who are sat there thinking about MedComms, and when we think about the expertise that sits behind MedComms, you will, of course, be thinking very much around the science and around the scientific expertise and around the data, and that is so foundational to the role of the MSL. But I hope that by the end of this short presentation, you will start to see that there are huge synergies between what happens within MedComms and what we focus on here at One MSL. So, as I say, this is me with my different hairdo. And really the purpose of sharing this with you is to give you an extent of the reach that we have. And we're very proud of our relationship within the global medical affairs community and with MSLs in particular. And we did an analysis the other day of the number of companies that are represented by this 11,500 followers. And I was astounded to see that, in fact, those 11,500 followers come from 629 companies. So most of you will have a far greater sense than I of the scale of this industry, but really the opportunities for MedComms to engage within the MSL community are clearly quite significant. So through LinkedIn, we engage in one of two ways. This is my personal profile you see on the left-hand side. And for those of you that would like to connect, I'd be delighted to connect with you. But we also have our One MSL page. And through that page, you can get access to all of the most recent updates and comments that we make that may be of interest to all of you working within medical communications. So who do we support? Of course, the MSL is a pivotal partner. They are the focus of this webinar, but the MSL is another member of the wider medical affairs team. And this slide, I hope, gives you a sense of the breadth of the medical colleagues that we engage with on a day-to-day basis. And very often, you know, organizations take a perspective, you know, we need to think about upskilling our MSLs, and the upskilling that happens within medical affairs can very much take an emphasis around the MSL. But I believe that it's equally important that there is alignment and consistency throughout the wider team, because there is such close collaborative working, or there should be, between the MSLs and these other colleagues. So to what extent do we have a global footprint? And this slide, I hope, brings this to life for you. So whilst we are based in the UK, much of what we do is at a cross-global level. And COVID, as for all of us, was certainly an accelerator of change for us in the way that we train MSLs. So literally overnight, we went from face-to-face training to a virtual training model. And you can see on the slide that we had an incredibly busy year over that time, working across multiple countries, multiple regions, and in different languages. And that is actually something that becomes very important, because when we think about MSL skills and when we think about their upskilling need, of course, they will be engaging with their KOLs and their physicians in local language. So it's important that they have an opportunity to practice in local language. Whilst most of the materials are produced in English, we do believe it's critically important that where needed, they can practice in local language. So how do we engage with industry? And the reason that I'm showing this slide to you is to give you a sense of the attempts that we make to truly understand what is going on for the MSL, what is their reality, where they are sat in terms of drug life cycle, where they're sat in terms of TA, where they're sat in terms of region. And we engage using all of these means. And if you go onto our One community, you'll be able to access past webinars or podcasts and so on. But in particular, I want to draw your attention to our annual surveys. And the reason for that is that I'm going to share some of the findings with you today. And we're going to use those findings to explore what that might mean for all of you sat within MedComms who are thinking about what it is that you need to create to best support the MSL. So often we make assumptions about what their needs might be. And I think that the survey provides us with some data that really can hopefully help ensure that you are optimizing your strategy and your approach. So these are just some thoughts that I would like to share with you on the role of MedComms in supporting MSLs and their activities. So in no way do I ever wish to cause offence. I clearly don't sit within MedComms, but these are very much my personal perspectives. So I hope you find them of benefit. If you have questions, I would really be delighted to explore your questions, your thoughts, your opinions as we move through the presentation. And if not, we will do that at the end. So what does this slide represent? And I think this is a very nice image, which to me is very reflective of the evolving role of medical affairs. You will all be very familiar with the McKinsey paper, which talks about medical as the third pillar. And that paper has had quite a profound impact on the role of the MSL within many organizations. And it is spoken about with almost every company that I talk to. And in some organizations, they're still trying to interpret what really this means for the MSLs within their team. But what I can share with all of you is that there is clear recognition that the MSL role is evolving. So I have been an MSL, and back in the day when I was an MSL, I was sat in the left-hand side of this screen. So very much as a scientific expert, we were perceived as being a support function to both sales and marketing. The expectation was that in terms of our competencies, that we would be credible in terms of our scientific presentations, but we were very much a reactive tactical function. So we, of course, wanted to be busy, but it was very much with this sort of support scientific communication hat. Today, there is a shift. There is a shift in emphasis of the role of the MSL, and the expectation is that the MSL will be recognized, of course, for their scientific expertise. And that's where all of you come in, you know, thinking about the materials and the activities that you are involved in. So the scientific expertise is a given, but there is an expectation that the MSL will be regarded as a true cross-functional partner. In other words, not working in isolation from the rest of the organization. And of course, we know that compliance has a role to play in all of this, but that the MSL is seeking to engage with a wide variety of external stakeholders through individualized engagement. And that is an important point to bear in mind. So the materials that are created as master materials for the MSL community, in order for the MSL to engage with the individual stakeholder, it's really important that they have the flexibility to use those materials in accordance with the interests and needs of the stakeholder they are engaging with. So rather than being tactical, it's critical that in order to add optimal impact and value, that everything that the MSL is doing, of course, is aligned to strategy. And that seems incredibly obvious, but historically, in the absence of clear strategic guidelines, MSLs could often be very busy going out, just talking and responding to requests without real consideration about the strategic alignment of what it was that they were doing. And of course, we all know that today we live in a world where virtual engagement may be the norm for many MSLs, and for many HCPs, their preference is to engage virtually. So actually, how effective are the MSLs being in the use of data to support the conversation? So it's that tricky balance between questioning, listening, speaking, presenting. So the whole time piece, the remote environmental piece. And finally, of course, we have the measure of true MSL impact and value as through the generation of insights. And whilst that may not be of such relevance to all of you sat within MedComms, this is a key driver for MSL activities. So what are those activities? And actually, the one thing that I would share is that the activities probably haven't changed significantly. What has changed are the capabilities that are expected of the MSL in the conduct of the activities. So less transactional and more transformational. And that does not mean promotional, that is quite different. But it is that the MSL needs to have a level of confidence around the way that they engage so that they can be perceived as being less of a provider of scientific information and more of a peer-to-peer, having more of a peer-to-peer conversation. So you'll all be very familiar with these activities, and as the asterisk shows, this is not an exhaustive list. But I just want to share with you this quote and just take a few minutes to think about this. This is an opinion from Jose as regional medical head of Novartis. So historically, the expectation might be that the MSL is out there able to communicate the data from recent congress, from publications, whatever it is. And the view now is that scientific data is very easily accessible at the push of a button. What is not so easy is the context, is how does that data sit in the context of all of the other data that are out there. So this is where the MSL, in terms of their capabilities and being mindful of all of the other organizations, the other companies that wish to engage with the same physicians, the expectation is that the MSL will have this ability to assimilate data, to review it, to be critical, and to share it in a way that is adding huge value to the requester. So who is the strategic MSL of today, and what are the skills that they need to have? And you see here a very simple cartoon representing the MSL as the bridge or the connector between the external community and internal colleagues. And of course, we know that, and I've to repeat, the scientific expertise is sat at the center. So thinking about MedComms, that is clearly absolutely critical that the MSL has access to the appropriate resources in order to demonstrate that expertise. But what we believe here at One MSL is that the triangle of success, as we refer to it, requires that scientific excellence is foundational, but that can only be successful if it's accompanied by engagement excellence and by a sense of business acumen. So at this point, I just want to share with you some findings of our 2022 survey, and I'd like to make some comments on some of those findings, which I hope will be of value to all of you on this webinar. So the survey is a global survey, and you can see here that we had over 560 respondents from 61 countries. So I think we can say that this truly was a global survey. And this slide just gives you a sense of the location. So for those of you that are working in a global role, you will hopefully see some value in the findings with respect. So knowing that there is very much a global perspective here. And this is an important slide because the MSL who sits within the large organization is likely to have quite a different role to the MSL who is sat within the medium-sized or indeed the smaller startup pharma or biotech. So the resources that they may have access to are, of course, likely to be way more comprehensive, within the larger organization. So as MedComms, consider the size of the organization and consider the types of resources that may be required, because it's much more likely that the MSL within the smaller organization will have a far broader remit than potentially their colleagues in big pharma. So I'm hoping that that makes sense. So think about the size of the organization, think about the role, or certainly seek to understand the role of the MSL, because it will vary hugely from organization to organization. So what may their needs be? And this slide also shows us here that not all MSLs focus on one therapeutic area. So the expectation, I mean, for anyone who's working in 3 or more therapeutic areas, that is a huge ask. And they are clearly having to, upskill around massive amounts of data when we're working in 3 or more areas. But again, it's also a useful question to ask. How many other areas are they working in? Because potentially within MedComms, you may only be working in one, for example, of 2 or 3 therapeutic areas. And what are the types of resources that they're using between therapeutic areas? And this is now an interesting finding that we have. This is a finding of the MSL. So where are they working today in terms of the drug life cycle? And you can see that when we compare the data from 2022 to 2019-20, the MSLs are starting to engage with the external healthcare community earlier, much earlier. So as early as phase 1, phase 2. So the activities, of course, will be different in terms of pre-launch. But if you think about the journey that the MSL is going on, so we know that this is clinical involvement. So as MedComms, are you involved with the generation of Congress materials? What are the materials that the MSLs might need to use to support clinical trials, to support evidence generation? And what is the thread? How does the thread of those materials continue as the MSL moves along the drug life cycle? So again, that is something that you might wish to be considering within your role as MedComms. And then we also want to think about who is it that the MSL is engaging with. So you can see that 3/4 of MSLs have got a defined number of stakeholders that they're engaging with. And here we see on the right-hand side that this is the range of stakeholders that they are engaging with in reality. So if we go back to my earlier comment around individualized engagement, so I should not be engaging with every key external expert in the same way. I should not be using the same materials necessarily for every KEE. It's really important that I seek to understand their interests, their needs, their specific area of research, so that I can adjust and tailor the resources that I'm using according to the interests of that KEE. And of course, we also then think about the channels of engagement. So again, it's the insights that you might wish to gather from the medical affairs teams that you're engaging with is who are the stakeholder groups that the MSLs are likely to be engaging with, and are we ensuring that these materials are fit for purpose for the relevant stakeholder group? So perhaps that's an incredibly obvious question to ask, but historically it was believed that MSLs only engaged with KOLs or key external experts, and today that is a really different picture. So I'm hoping that that is providing some food for thought. And then of course, we have channels of engagement, and these findings won't surprise you, but you can see that today 94% of MSLs are engaging remotely. And when we do trainings on impactful scientific engagement, remote impactful scientific engagement, very often we'll ask MSLs, are the materials that you're going to use fit for purpose? And quite often they will say, no, we don't really feel that we have the materials that are adding greatest impact to support remote engagement. And of course, this will be something which is evolving constantly as we learn more. But it's also interesting to note, I don't know whether you've picked this up, but 40% of MSLs are actually engaging using WhatsApp. So, and that is a significant change, a significant finding. So in that instance, of course, you know, it may be that they're attaching documents because we know there's WhatsApp for Business. But again, just this is a slide that you might, and these slides are available on our One community. This is not proprietary content. We're really happy to share these with all of you. So I hope that you're finding this helpful. So just in summary, because I agreed with Peter that I would keep this to sort of 45 minutes, I just want to consider and to summarize for all of you what I believe to be MSL current reality, so that we can, as a group, explore what that might mean for you sat within MedComms. So number one, the role is evolving rapidly. There is an expectation that where commercial colleagues are facing access challenges, that the MSL is the face of the organization. The MSL is the scientific face of the organization. And for some MSLs, there can be confusion around what it is that I'm expected to do. But I think that, you know, in terms of the discussions that you might be having, you know, an interesting question is, what are the expectations of the MSL within this organization? Are they seen as a reactive support function, as in the communicator of science, or is the role perceived in a different way? And it will be different from company to company. Point two, we've touched on this. So I think that hybrid engagement will be the norm. And of course, there's a lot of conversation today about omni-channel engagement. But from the perspective of the MSL, is the expectation that they will be using the same materials if they are engaging face-to-face versus remote or virtual engagement? And if that is their reality, what needs to be considered in terms of the materials that are created and provided? We spoke earlier about the fact that we know legitimately the MSL can be engaging within the medical community from as early as phase 1-2. So if we think about the impact that a company is trying to make and the relationships they're trying to build, the evidence they want to generate, the insights they want to capture, which can clearly inform strategy, it's important that there is a thread, that there's a story. And I'm not sure at what point medical communications become involved in that particular journey. But again, that is something which may be worth considering. You do not need me to share that we are working in a world where the scientific interventions that are available are becoming so complex. And of course, the MSL is expected to be an expert on the company products and on its data. But actually, if we stand in the shoes of the stakeholder, of the external healthcare physician, their assumption will be that the MSL has got an awareness and understanding of everything that is available for treatment within the particular TA. So again, something to consider: to what extent are other treatment options being built into trainings and into materials that are available. We've spoken to the fact that there is an increased breadth of stakeholder groups and decision makers, and the expectation that the MSL will really want to engage with each individual based on their specific interests and needs. So are all of the activities and the resources fit for purpose for each of those groups? This is a big one for me. So for every external stakeholder that exists, more than one individual, as in more than the MSL, will also want to engage with the same stakeholder. So if we think about the fact that commercial and the MSL may be engaging, and of course the MSL will be engaging in an objective, non-promotional fashion, but are the same agencies even producing the materials for both commercial and the MSL? How aware are they? What are the connections? Because sometimes they may not even be aware of what's being created. So how many groups of individuals will be seeking to engage with the same stakeholder, and what does that mean for what is being provided? We spoke to the fact that scientific data is easily accessible. So if physicians are able to access company data at the push of a button, what is the above and beyond value that we can offer? Coming back to the comment from Jose, so thinking about the context of the data in the overall cohort. And finally, point 8 is repeating really point 1. What is the true purpose of the MSL role? And my final slide really is a plea. We've had a number of very successful collaborations working with MedComms companies who recognize the importance of aligning scientific excellence with engagement excellence and business acumen. So when you are thinking about the MSL and their needs, of course, it's really important that they have access to the right materials, but are we really thinking about where the challenges come in, where the questions will come in, where the opportunities are coming in for true scientific dialogue, and what does that mean for skills? So that brings me to the end of my session. I want to thank you all for your engagement, and if you would like to connect with me, please feel free to use the email address on the screen.
Excellent. Thanks, Helen. That's great. Can we lose the slide? And we've just got a few minutes to have some questions here. So anyone in the audience who'd like to send us any questions, comments, whatever, use the two text boxes that you've got. Helen, I don't want to go too far with this, but a little bit of context here, or a little bit more context here. The MSL is a relatively new role, and I'm sort of thinking for people who may be not terribly familiar with the MSLs and so on, just a little bit of context. So what's a typical MSL in terms of background and qualifications and so on? Just paint a brief picture of the sort of person to be an MSL. Really
good question. So the MSL of today, we did ask the question in the survey, the MSL of today is likely to have a higher scientific degree. So about 30% of MSLs have PhDs, and we can have MSLs who have MSCs. You have a lot of people who come in, Peter, from healthcare, from pharmacists. We have nurse advisors who join as MSLs, and we have individuals within companies who make the transition from, for example, other medical roles, or indeed from clinical operations. So a wide variety of backgrounds. There was a view at one point that in order to be an MSL, you had to have a PhD. And the argument today is actually we can train for science. It's much harder to train for skills. So when we think about transferable skills, so there are some superb people sat in academia who are incredibly intelligent, but actually making that transition from academia into pharma can be quite a steep mountain to climb. So it's depends on the company size, Peter. It depends on the drug. It depends on where they are in the life cycle. There are so many factors that influence it, but the role is growing at a massive rate.
It does seem to be from where I sit. Again, asking a very basic question here, but maybe one that some people might be interested in. You know, the MSL is a field-based role, largely.
In the main, yeah.
How do they sit? And you touched on this, but just a little bit more. How do they sit alongside the medical rep? And what are you touched a little bit on it, but just talk a little bit more again of compare and contrast the rep versus the MSL, type of work, and so on.
Okay, so when you talk about rep, let's call it our sales colleagues. So the objectives of the sales team are really it's all around promotion. It's the provision of relevant information which will enable physicians to prescribe. So the measures of success, if you like, for the sales representative is the resulting prescription that will follow, patients receiving access to the drug. The difference between the MSL and the representative is that the MSL role is defined as non-promotional. So the language that they use should be scientific, it should be objective, it should be non-promotional. So the intent of any interaction should never be a commercially focused objective, as in, I want you to prescribe. It's about providing information in a balanced, objective way so that physicians, whoever, can make the right decisions for their patients. So, and you know, it's a complex area. There are ways of working guidance that are there to clarify that, to try and remove the areas of grey that can exist. But for most MSLs, you know, they will use, my role is to be non-promotional. That is language they will use. But I often say to MSLs, that is industry language. That means absolutely nothing to our physician outside. So how do you choose to introduce your role so that the physician understands what the value is that you are able to bring?
Okay, again, interesting. We could probably go further, but it's interesting, I think, to think about the context there and to understand how these people work together. So Paul's come in with a question about MSLs having to wear lots of hats. He's saying that they've recently been supporting MSLs in managing advisory board meetings, which is not something that he's seen before. And I guess the point there is the MSLs are getting very involved in an increasing range of activities. And whether that's going to cause a problem, you know, in terms of the MSL being so stretched and so on. Do you see that as a problem? As the role expands, it actually becomes its own problem?
No, not at all. And actually, Paul, it's really interesting to hear that is what you're seeing. I've known MSLs be involved in advisory boards for many, many years. I think it's the extent to which they're involved. And clearly, when we think about the experience of the MSL, the running of an advisory board is not a task you would necessarily give to a relatively inexperienced MSL, but there are some MSLs out there who've had 10, 15 years experience who are super confident, you know, and more than capable of running advisory boards alongside their medical colleagues. So I think you'll probably see a lot more of that moving forward.
Okay, and just out of interest, so I guess there's two areas in which MedComms could, I'm simplifying things, but you know, MedComms may interact. I mean, some MedComms agencies can provide training information, educational information for MSLs to be trained, yeah? And there's also the providing support materials items, content, whatever, for the MSL to use when engaging with their audiences. Yeah, so it's slightly two different sides there. With that sort of on the side where you're supporting them, providing engagement with the healthcare professional and so on, I just wonder, have you got some comments? And again, we touched on this a bit, but some more comments in terms of how the MSL has seen that changing engagement over the last couple of years, the increased digitalization and so on. And I just wonder what the feedback is. I mean, are they positive? Do you think this is a great opportunity to engage people in different ways because HCPs are loving it? Or are there problems?
So I think it's probably challenging. I think the expectations of the MSL are really quite significant. So on the one hand, it's expected that they will be as up to date as possible around the disease area, what's happening, what's moving, what's new, what's fresh, what they need to know, what's coming out of Congress and so on. So on the one hand, there's an expectation that they will have enough time to constantly upskill, to be on top of their game with respect to knowledge. But I think that then sits alongside the fact that physicians, as we said, and stakeholders are able to access much of this information. So the data doesn't speak for itself. So really, the challenge then comes with the MSL having the confidence to understand from the physician what is their interest, what do you need to know, what are your concerns, what are your opinions. So rather than me coming to see you, Peter, and saying, I've got this data and I've got 60 very nice slides here that I could spend the next 90 minutes sharing with you, actually for the MSL to say, I have a great deck here, but actually what is going to add most value to you, Peter, in terms of where you are at the moment in the management of your patients, and truly not only asking that question, but listening to the answer and then using the materials in a flexible way so that I'm being respectful of your time and your need and your interests. So I think the challenges are that physicians are fatigued, they have less time, they are dealing with maybe 4 or 5 other companies who also want their time. They're not differentiating between the MSL and the sales guys. So there's so much that needs to be considered for every interaction. And I think that the MSL of today has got the ability to think about the jigsaw, to think about all the moving parts and say, have I really planned for this interaction? Have I got everything that I need to best support me?
I'm going to push that one slightly, and maybe I asked the question slightly wrongly, but I'm going to just push this slightly, because what I was interested in was, is the feedback you're getting through the MSLs that their audiences are embracing the opportunity to work together virtually as opposed to face to face, and just as a general point,
it depends. It depends.
It's generally positive experience.
Yeah, some physicians love the opportunity to engage virtually. They do it at the beginning, at the end of the day. But we have within many countries, nothing has changed. They've continued to engage face to face. In other regions, there has been this massive shift towards virtual engagement. And the MSL aspires, most MSLs would much rather be sat face to face with a physician and having a conversation. We all would prefer to be engaging face to face. But the reality is that the world has changed. And actually, we should be engaging according to the preference of the physician and not on our agenda. So,
okay.
Yeah.
I find that area just interesting, because there's a sort of, we have to do things like this versus what people want to do, and there's a conflict in there, sort of thing, and how that pans out in real life, sort of thing. And to cover off this, so that's sort of talking to the HCPs and so on. The other side, in terms of like MedComms engaging in terms of providing educational support for the MSL to teach them, or I guess that's all remote, and that again is just, that's the way life is now. They're doing their training much more online.
Yeah. And again, it's think about learning preferences, and MedComms agency will be familiar with this. we all prefer to learn in different ways. So are the resources that you're creating available in a variety of formats that address the different learning preferences of the MSLs involved? And to what extent are MSLs being invited to comment on what they need? Because so often those decisions are made 2 or 3 levels above the MSL, and yet they are expected to, to both be competent, but nobody has taken into account their needs. So again, is there an opportunity to seek feedback from MSLs around what will best support them?
Okay, which is a good message to end on, I guess. Let's go out there and talk to each other. I'm gonna draw a line there because we are slightly over time again. But thank you so much, Helen, because that was really quite insightful. I think it's important to understand the roles that are out there and how we engage with them. I'll state the obvious. I know I can say on your behalf you're very happy, and you've actually already said it several times. For people to contact you via LinkedIn is the easy way, but you'd welcome comments and questions from people. So part of the point of these webinars is to try and help people connect with each other. So I would encourage everyone to do so. So I'm going to draw the line there. I'm just going to say, obviously, my little plug, if you want to know more about what we're up to at MedComsNetworking.com, you'll find it all there. Otherwise, I'm going to ask Helen to give us a little wave, say goodbye, to shut the recording, and we'll wish everybody, in these rather strange times, to look after yourselves, guys. Okay, take care. Cheers. Thanks, Helen.
Thank you. Bye.